You are listening to the Special Needs Children podcast with Chitra Iyer. Chitra Iyer is a parent of 24-year-old Shravan Iyer who has epilepsy, cerebral palsy and autism. She is the CEO of MFA and has been helping families with life-centered planning to reach their personal financial goals. She is also a trustee of a parent support group, the Forum for Autism, which was set up almost 2 decades ago. MFA is a 17-year-old organization working in the personal finance space. They have set up a dedicated practice to help families with special needs children to plan their financial goals and invest for them. The thoughts shared here are a result of the discussion with parents, caregivers, siblings and professionals regarding the planning of a person with special needs. In this expert series podcast, Chitra Iyer is talking to Dr. Meenakshi Kher, a leading pediatric dentist who runs the Happy Tooth Clinic for Kids. Dr. Meenakshi is an expert at dental treatments for children with all kinds of disabilities. In this interview, she speaks about dental issues faced by children, what happens as they become adults, and addresses key questions parents usually have about dental treatment for children.
Hello everyone. A big warm welcome to all of you to this expert series of my podcast for special needs children. Thank you for tuning in. I have with me today a very, very dear friend, an extremely passionate human who is so fantastic at her work and who I've known for more than a decade and always reminds me of the wonderful work that she does, Dr. Meenakshi Kher. Hi, Dr. Meenakshi.
Thank you so much, Chitra, for all the lovely words. And it's been a pleasure knowing you through these years. And thank you for having me here.
Thank you. Thank you for your time. Just introducing you to all our listeners. Dr. Meenakshi is a leading specialist in clinical pediatric dentistry in India, having practiced till date for 30 plus years. She received a master's degree in pediatric and preventive dentistry from the Nair Hospital Dental College in Mumbai. In 1995, she established the Happy Tooth Clinic for Kids. And it has been a huge blessing for all of us in Mumbai. She takes a special interest in the field of minimal invasive dentistry, dental traumatology, treating children with disabilities, and in the efficient use of soft tissue lasers in children. Dr. Meenakshi and her team at Happy Tooth, which is an absolutely beautiful state-of-the-art clinic, which all of you must visit, which is in Mumbai, has a huge fan following amongst the patients, their families, and all of us. She's very well known for her work in this entire space. She's been teaching and lecturing working dentists with the nuances of the subject both nationally and internationally. She has authored a book with Springer International publication in 2019 called Contemporary Treatment Techniques in Pediatric Dentistry, which also addresses techniques to be used for children with disabilities. So, really happy to have you for this chat, Meenakshi, and I'm diving straight to the questions.
Yeah.
So, you have been extremely passionate about your profession as a dentist, especially to children. And you also take care of, I see how you address the family's concerns and how when they come to you, it's always with a huge doubt in their minds. Can you please share your journey as to how and why you chose to become a dentist, how everything fell in place for you?
So way back in the late 80s, when I had to choose my profession, I can't claim that I chose to become a dentist. I think awareness about dentistry was still there wasn't that much awareness. And of course, like most dentists in my times in the late 80s, I went into dentistry because I didn't get my first preference of medicine. And I think it's a blessing that actually happened. So 1987 is when I started my journey as a dentist, little knowing what it entailed. I had no idea what dentistry was all about. And then I think that this journey that you're talking about perhaps started in 1991 when I became a dentist and I had to decide what I wanted to specialize in. And by then I had realized that, I really enjoyed working with children. I seemed to be very good with them. And I also like working with people, with families. And, one of my main choices for my specialization, my master's, because in dentistry, you have a 3 years master's after a 5-year undergrad degree in the BDS. So I did my MDS in pediatric and preventive dentistry. And, even while studying for my master's, we were exposed in those days only to that there was no internet. So obviously we were exposed to all the textbooks where we saw all these pediatric dental practices in the West, in the more developed countries, and how they treated special individuals with special needs, and how the environments that they had. And it was always my dream. Even then, I had this mental picture of how my practice should be. And in 1995, when I started my practice, we had a play area, which was not so common in those days. So we had this, you didn't have play areas in malls and everywhere you went like you do today. So play areas were unusual then. So we had a nice play area and a waiting room and I always, I was always keen on having an environment that was warm, that was not very clinical, and where a family felt comfortable. Because dentistry has always been associated, even today, unfortunately, it's associated with fear, with unpleasantness. And you have the family, the parents or the caregivers who are already terrified even before they get their child or the patient to you. And so the child may know nothing about what's going to happen, but just the unease of the caregiver just makes the child terrified even, before they want to enter. So I always wanted a nice, warm, comfortable environment. And that's what, I've strived for. And I think that's what you appreciated in our practice. We moved a while back to a new facility. So obviously I could add a little more, finesse to it. And I think, people really enjoy the space. There's activities for the children to do. It's just calming and a little, comfortable for all children and even adults with special needs. So
I can totally, certify that as somebody who has really, really benefited from this. And, that's something that I think you need to definitely talk about. What is it that you're doing specially? It's so special. Just visiting your clinic, what are you doing at Happy Tooth for Children?
So basically the entire team is really well trained to take care, to take care of children, their families, and to take care of all families who have a child or an individual with whether with physical, with medical, or with neurocognitive disabilities, neurodiversities. I think they're all really well trained. I'm just very proud of our team and, how sensitive everyone is. And they've been with me for 2 decades, or many of them even more than that. And I think that is the biggest plus. It's the people around there who, apart from the environment, who make families comfortable. So right from the time a patient steps in, I think they feel a little, they feel like this place understands them or understands where they are coming from. And we really do our best to do that. I want to say, even before we proceed, Chitra, that I just feel, every day I feel, and this is really coming from my heart, that I feel blessed that I have the opportunity to work with all these families and to be of some help, to the child who needs, to the child or the individual who needs my care. I genuinely feel blessed. So apart from basically the human angle where we are hopefully more sensitive to the needs of the families that visit us, which actually puts families at an ease. The thing is, with different kinds of special needs, the requirements are very different. But especially if you look at neurodiversity, a lot of children enjoy music. Even with other special needs, they may, enjoy, they may really like, for instance, a certain show on television that they really like to watch every time, or there would be some kind of music that suits them down. So when we have to examine them, we have these television screens on top of our dental chairs where we play their favorite music, which comes, where this particular child I see every 6 months comes to mind. He just loves these advertisements, these particular Tata Sky advertisements that he wants me to play every time for him. And then we do that. So fortunately, and then that just makes him feel like, it just makes us feel comfortable. So we kind of do our best to get the patient as comfortable as possible. We have children or older kids who are not comfortable sitting on the chair. I might even examine them on a sofa. I might examine them in the waiting room. So I'd wear my loops. I have a little light on my forehead that helps me. And then we can examine them even without them necessarily sitting on the dental chair if they are completely reluctant to be on the chair. Where treatment techniques are concerned, like you mentioned, even in the book I wrote for our colleagues, we do what is called minimally invasive dentistry. Now, this is an area of dentistry where we completely avoid the use of the drill, which is the most dreaded thing, right? And for any individual, the drill is not pleasant. But especially when a person has neurocognitive diversities or they have other sensory issues, you can only, we understand, we don't have to imagine, you understand and I do too, how unbearable the noises, the sounds and the sensations that our tools make could be for them to tolerate, right? So minimally invasive dentistry involves techniques where we don't use these drills at all. We use something called gentle burrs, which very, very gently, they are like hand-driven instruments that very gently treat the disease. We have solutions like, for example, something called silver diamine fluoride that we apply on cavities to arrest them. And we use these kind of techniques very, very often when you don't have disease that's really gone out of hand, like you don't have infections, when cavities and other oral diseases are caught at an early stage. So these minimally invasive techniques are very useful to gently treat disease and to also avoid, pharmacological management. That means the use of sedation and anesthesia, because that's always our last resort. So that's something we specialize in. And of course, we are trained in sedation and general anesthesia, which many of our patients require. The other thing, especially that we have in our new practices, that we are accessible. We are wheelchair accessible. So as children grow up, many of them, especially with cerebral palsy and other syndromic children, might require a wheelchair. And families that have family members using wheelchairs only know in India how hard that becomes when they have to travel. And so it really gives me pleasure to see that the patient can get off from the vehicle they are coming in and wheel the child or the adult right into our operatory. There are children and adults that I treat on their wheelchair. We don't even have to transfer them to the dental chair. In the new practice, we've just set the whole thing up where the wheelchair can come right to the dental chair. And I'm really happy it is accessible, though that the practice is accessible, though I have to add here that you and I know, coming from Mumbai, that in a city like Bombay, being accessible is not so easy even for the caregiver, for the practitioner. So it's not something we can expect every time, but when it is possible, we must do our best to make our practices accessible. The other thing that we do, that we have been doing ever since I discovered this medium, Instagram, because like you said, I've been practicing 30 years and it's always been frustrating for me that the level of awareness just doesn't increase. Most dental diseases are completely preventable. And had the caregiver only been taught how to prevent dental disease, perhaps the situation only would not have arisen, but we never get access to the patient or to the individual rather, who's not even a dental patient. We don't have access to the caregiver to teach them how to prevent dental disease. So I always see patients only after the disease, they already have dental disease in the mouth, and everything is so easily preventable. But educating and reaching out to patients has always been so hard. So when we discovered this medium, Instagram, it's just been a year and a half, and I just thought it was a great tool to educate parents. So we've been working very hard on our Instagram page. It's just baby steps right now, but we've created a lot of videos on brushing techniques, on the correct diet, and a lot of that. And hopefully that also helps families. So that's what I can think of, Chitra, to think of how we may be different from other dental clinics.
I think your videos are just superb, and I think you have a large followership also. The frequency at which you release and this minutest things that you've done, and also you make it so lovable for children to look at. So it's amazing the way you've gone about, and even the whole clinic, the way it looks so beautiful and colorful, and you engage the child so well is something that I have experienced. And yes, I remember how you have actually followed Shravan through the entire room and your clinic with your glasses to just get one quick peep into the mouth, right? Whether it was on the sofa or it was at the table, or when he was lying down and looking at his Teletubbies on the chair on the ceiling that you would put up the TV on, as well as at the sink when you were trying to brush his teeth and trying to peer in. So coming to this now, Meenakshi, what causes the major dental problems in children with disabilities? How would you like to guide parents to protect their kids' teeth?
Right. So what are we looking at when we talk about dental disease? One is dental decay or cavity, which is the same thing, just different words, or dental caries. They're all the same thing. It's basically dental decay and cavities, which then keep progressing, get deeper, cause pain, cause infection. The tooth gets infected. It needs a root canal treatment. Then it needs an extraction. So this is all dental decay and how it progresses. And the second is gum disease. Where dental decay is concerned, what causes it is sugar in the diet and inadequate brushing. But it's basically to start with sugar in the diet. So we're talking here about free sugars. And what are free sugars? We've got two kinds of sugars. The sugar that is naturally present in your fruit and vegetable, that is complex sugar, and everything else is free sugar. So free sugar is your white sugar, your chini shakkar, right from your chini shakkar to honey, to gur, to jaggery, to every product that has sugar added in it. Everything is free sugar. Now, obviously, we are not saying here that you don't add sugar to the diet, but we must recognize that each of these things is sugar. So when you have your chai biscuit, there is maida and sugar going into the mouth. The more sticky the sugar, the worse it is for teeth. Now, so sugar is highly addicting, and once sugar is introduced early in the diet, most families will not be able to, they become sugar dependent households, let's say. So you want meals sweetened in some way or the other. It could be meal sweetened with some jaggery on the side. It could be, a pickle. It could be jam. It could be ketchup. It could be your biscuits. So all of these will add to the sugar load in the mouth and will add to dental disease. So ideally, especially when you have children with disabilities or special needs, cutting down on the sugar will go a huge way into reducing decay, because a lot of children have orosensory issues. You're working with so many other, areas. Oral hygiene simply has to be cracked, meaning you've got to get that brush in and get the brushing done twice a day. But there are sensory issues, so that makes it even harder. The brushing becomes tougher. So the first easier thing to do is to cut down on sugar. Now, what I've noticed is in India that Unfortunately, the multidisciplinary approach does not happen. And I'm aware that when therapy happens, often speech therapists perhaps use some sugary item, like it could be a Nutella or it could be jam or it could be honey in order to, perform therapy, which I've noticed, I've discussed with specialists outside of here where they avoid sugar because they know it causes cavities. So we need to be more, that is us, not the patient, but us as professionals. We need to be more multidisciplinary and work with each other. And sugar should not be used as a bribe or as a, right from the beginning. Once it started in the beginning, then you're stuck. Then you need to use that biscuit or that sweet or something as the reward. But if we can avoid sugar as reward or sugar for therapy, it'll go a long way. So then patients ask me, then what do we use for therapy? Then, even if you use, let's say, if you introduce them to, let's say, cheese spread. Cheese spread is equally sticky. And if you were to put cheese spread on the tongue and say, lick that off, when you want to help them move their tongue, that would be better than giving them something sugary. But these things have to be inculcated earlier on. Now, where brushing is concerned, there are some techniques we can start off with that make brushing easier. When patients come to us in the practice, we literally get the child to lie down on the sofa. We sit and we brush in the mouth and show them how to do it. But obviously, if it is now a 16-year-old who's brought to me for the first time and they are resistant, they are not going to let me brush in the mouth. So the sooner we see children, the better it is. But this can only happen with awareness. And literally, we need to spend not more than a minute and a half twice a day on good brushing. But then it's about the technique, the right paste and brush, and how to go about, the whole, the activity. And the earlier it is introduced and the sooner the child gets used to the sensation, the better it is. And when should brushing be introduced? When the first tooth enters the mouth. So literally by 1 year of age, every family should be brushing their child's teeth. And in India, traditionally, we just don't do it. So that, the issue begins there. So it's all about awareness, Chitra, and cutting down on free sugars and introducing good oral hygiene. These are the main things to prevent dental disease.
So very well said, and all of us are guilty of this. But yeah, repeatedly, I think listening to you and seeing your videos is the constant reminder to say that, you get back and on track and do this for your own self and as well as for your children. So,
and Chitra, sorry, I'll just interrupt. It's not about, so once we've reached a certain stage, right, that is the child is used to it now. You can't suddenly cut everything off. I understand that. Then we need to have some tips and tricks to, work on it. Like just last week, I did a little reel on chai biscuit. Now, chai biscuit is something so traditional for most of us. We can't have our tea without those biscuits, right? Because it's just what we are so used to. So have that biscuit maybe once a day instead of one biscuit. So basically, that one pack of biscuits, if you're going to have one biscuit 5 times a day, it's 5 attacks on the teeth. I want them to have the entire pack all together at one time, follow it up with maybe nuts, a fistful of peanuts and chana maybe, just as an example. That kind of washes that thing away because you can't brush 10 times a day also. Brushing itself is so much of a challenge with, with children who have orosensory issues. So then at least a fistful of nuts will wash the biscuit away. So you're reducing the load of sugar on the teeth. So we've got to look for tricks. So we are not expecting miracles here. We've got to work together to find solutions to make it easy on the caregiver also. Because it's easy for me to throw instructions at you and say, stop this and stop that. It has to be practically possible, right? So we've got to work together on it. Absolutely. For each family, it has to be individualized. See what their environment is and then work with each family to figure out what is best possible for them.
Sure. Absolutely. I think you just said it bang on. And I'm moving on to, how do you check children who are non-compliant? Somebody like my son doesn't even open his mouth. I'm sure that you're seeing so many children in and out. What do you do? How do you land up? What all do you do to get them to actually show you their teeth?
So again, Chitra, very, very age dependent. So no matter what the kind of disability, when it is a small child, it's easier. Simply because physically they are smaller, so it's easier to hold them down and at least do a thorough examination. This is not to trouble them or not to not recognize that they don't enjoy it, but it is simply that when we can examine thoroughly, we can help them properly. So also, when a child starts to come in very early in life, they slowly get used to the whole thing. They get used to the routine, like every other routine that a child with special needs will get used to with repeated exposures. So it is simply the same thing here. So we always have this policy of tell, show, do. Now, depending on, of course, the kind of disability, like if you're looking at neurodiversity, it's a whole spectrum. So depending on where the child is in that spectrum, or for other disabilities, what the level of neurocognitive development is, we will tell, we will show, and only then we will do. So we always demonstrate. We have these little puppets, and you've seen them, Chitra. So we've got these little puppets which have where we actually demonstrate what we will do. Then we would actually show them what we'll do. We'll first tell them, show them, then do it. For some children, this will work. Obviously for others, it will not. When a child is smaller, we have the parent lie down or the caregiver lie down on the dental chair, and the child lies down on their lap. So that provides some level of security. And then, like I said, if they love music or they love a certain kind of show that they are, very used to watching or they're fixated on, we play that for them so they're a little engaged. Some of them this is good enough for them, and they actually let us examine. Many children will even let us treat them. But these are normally the younger children. If children love you to sing to them, I'm very often singing with the parent, or I'm singing to the child, and they're slowly doing, minimally invasive dentistry. Then there are children who require major treatment, because by the time they've come to us, everything is a mess. We may need to restrain them forcefully. They may be kicking and screaming, but we do a thorough examination. We may take our x-rays. When it is a smaller, these are not painful procedures, but they hate it that we are doing something in their mouth. But, we need to restrain very, very quickly, take a look, take x-rays, so we know what we have to do finally in terms of treatment. And then oftentimes these children will then need treatment under general anesthesia or some kind of sedation. So we have something called inhalation sedation. So this is happy or sweet gas, nitrous oxide oxygen. It's a little mask we place on the nose. The child is lying down watching TV, being engaged, and we place a mask on the nose, and it really relaxes the child. Children with neurodiversity in the autism spectrum who may not even be verbal, but who are more compliant, very often when they are younger, once they get used to it, they actually lie down on the chair, they wear their headphones, the parent is sitting right next to them, and they accept the nasal hood on their nose, and as they're breathing, they feel extremely relaxed. What this does is it's an anxiolytic. So the anxiety goes away. The sounds of the drill and all the unpleasant vibrations are kind of muffled because the headphone is on and they're listening to music. And then we do simple dentistry in their mouth. But many older children and adults may simply not open their mouth. Like you mentioned, Shravan, he would refuse to open his mouth. So in such situations, even examining them on the sofa, examining them standing, any position, at least take a quick look in the mouth. I may not manage my x-rays. And then we, of course, need general anesthesia to treat them. So we do all our x-rays under GA in the operation theatre and then get the treatment done. The constraint here is we get only one sitting to do the treatment. All of you would have been to the dentist at some point in your life, and you'll notice that you need multiple sittings normally to get the job done. When we take a patient under general anesthesia for dentistry, we do not want repeated anesthesia procedures. We want to get the whole treatment done in one sitting. So in that sense, the treatment becomes the dentistry we provide is tailor-made or you could say compromised, but in the best interest of the patient, we try to tailor-make it to a treatment plan that can be completed in a single setting. And the whole thing is done under general anesthesia in the hospital. And it's a half-day procedure. They come in the morning, and by evening, the whole family is back home with the treatment accomplished. So I guess this is the whole spectrum of treatment that we would be able to offer. Sometimes when it is very simple dentistry and the patient is not is not an adult, is still a younger child who can be restrained, and it is not painful dentistry, we would actually restrain the patient, place what is called a bite block in the mouth. It's a prop that holds the mouth open. The child will hate it. But what we are avoiding here is general anesthesia, which is then in the child's best interest. Also in children who are, who we can restrain physically and who do not require extensive dentistry, where we know that the treatment is not going to be painful, but obviously the child is going to hate us doing all that in the mouth. Then with with the parents and us together, we sometimes decide we will simply hold the child down, physically restrain the child, and we have, the gentle methods of doing it. We restrain the child, put what is called a mouth prop in the mouth, so the mouth remains open. We're talking to the child, trying to calm the child down, and we quickly try and finish the dental treatment, thereby avoiding general anesthesia. In all of this, the most important thing after treatment is done is prevention of further disease. Because when we do dentistry, what we are doing is repairing the damage that's done. This by no means prevents further disease. Unfortunately, there's no vaccine for dentistry and it's ongoing care. So establishing good dietary practices and establishing good oral hygiene. My team and I, we really work hard at helping families establish those two things. Because that's really what we have to do to prevent disease in the long term for these families.
Totally understand what you're saying. Yeah. What I wanted to ask you now is for what about where the children would need sedation, right? If there is this dental work that needs to be done, I've heard parents, being worried about it. So how do you handle anesthesia during surgeries?
So basically, fortunately, as pediatric dentists, I think we are one of the only specialties that are trained in doing regular dental treatment under general anesthesia. So it's a part of our training. And then when we come out into the world of private practice, we set up the entire dental setup in the operation theater. Because as you know, our equipment cannot get into a tiny suitcase. So we've got to put all of that equipment in the operation theater and equip an operation theater facility for dental treatment. I have been very fortunate to work with an extremely senior, experienced and wonderful anesthesiologist. We've been working together for more than 26 years, and I wait for Dr. Salyankar's time to treat all my children with disabilities and special needs because many of them are also medically compromised. It's not only neurodiversity, right? Many of them have medically compromised situations. There are many with syndromes. So we need an expert anesthesiologist. And he's, again, extremely sensitive and a fantastic person. So unfortunately, dentistry is normally not an emergency. All emergencies can be managed with medication. So we can wait for the right time that's available mutually for the family, for the anesthesiologist and for us. So we equip the general anesthesia, the operation theater for dentistry. Obviously, when your child or your family member goes under general anesthesia, it is always a source of worry because general anesthesia goes with an inherent risk, right? So here, what is most important is the expertise of the anesthesiologist, which we are fortunate to have, like I said, and a well-equipped OT. The dentistry actually is the easy part because it's what we do in the dental clinic. However, when we work under general anesthesia, we are restrained by the position of the patient, right? They're not on a chair, they are flat on an operation theater bed. But all of this we are used to because of the years that we've been working in the OT. So it is natural for a family to be fearful about general anesthesia. And once you know you've made the right decision, you're in good hands. You have to wait with that feeling of unease for your child to come out safely after treatment. That little unease will be there. But general anesthesia, when done well, is extremely, when you're in the right hands, the right equipment, you're extremely safe. And very often that is the only way to provide treatment, because dentistry, no matter how wonderful we are as dentists, is not easy for any patient, right? Because remember, it's a voluntary job. You have to voluntarily allow the dentist to do all those things in the mouth, and nothing we do in your mouth is pleasant. So to expect a child to voluntarily allow all that to be done in their mouth is not easy for the patient, for any patient, for you for that matter, to leave alone for your child, right? And if the child has sensory issues, even more for that patient. So very often general anesthesia is a must. The other thing, so fear is something, once you are calm and you have figured that you are in safe hands and you have faith in the people the team you have chosen to help you, then with that unease, you have to wait for your child to come out safely, is what I'm saying. The other issue is, of course, the expense of general anesthesia, because it definitely becomes more expensive. You're spending on the operation theater, on the hospitalization, you're spending on all the extra medicines, you're spending on the anesthesiologist, and for the dental team to be operating in this space that is not their home ground. So expense-wise, the family has to prepare for this additional expense, Chitra, which is, so every time I'm speaking, about all of this, I just keep, thinking this is preventable. But for you and me who want to work in this space, creating awareness, Chitra, will be just the only way to introduce prevention. Because a family with a child with disabilities and special needs is just handling so much more. And in India, teeth are in any case the last thing that people are thinking about. So the last thing that crosses their mind is teeth. And until the damage is done, nobody even realizes something is happening inside the mouth. And all of it is preventable. So it's all awareness, I guess, at the end of the day.
Absolutely. I'm going straight to that topic only now, Meenakshi, that,
okay.
You've helped so many families with disabilities. You are our best friend, when it comes to what you're doing for our children. Similarly, every parent would, love it if, there were a professional like you out there for so many other things that are, required for the child, right? In fact, I was just thinking back when you were talking about, if only we could have started much earlier about getting the kid to sit on the dentist chair. I was just thinking that the parent is usually worried about so many other things that are going wrong.
Exactly.
And they're trying to address that, this important aspect completely, you'll end up missing it. Therefore, we have to go back to requesting, professionals to be more mindful, to give priority to, and more important, to be like you. They're people who are trained and actually know how to handle our kids. So my question to you is, how best do you feel can we encourage more professionals and also the society as a whole to accept, any individual with a disability, be it a child, an adult, what would you say?
I wish I had a nice crisp answer to this question, like I had to all your other questions. Because Chitra, I think when you say society and professionals, I think it has to start with the society first. And I think in our country itself, our whole understanding and our sensitivity and what we do for the disability space itself is so lacking, right from top down. I think it just has to start top down, right? So just making spaces more accessible to increase sensitivity. I don't know how we are. And here I know, because this podcast is going to groups and to individuals who work in this space. Wherever you think we can be of help to you, my team and I will be very, very happy to do whatever we can. But I think awareness is first a key, Chitra, and and then sensitivity. But honestly, how do we increase awareness? I don't know, through this initiative that you are taking, through more podcasts, through more social media endeavors, and anything else that you suggest, because I really, I'm very, very happy to,
I guess
be of help, but I'm not sure.
lot of awareness exercises will definitely help, and that's exactly what we've tried to do today. By
Yeah.
putting such a thorough professional like you in front of people, so that they're aware that first of all that you're there, and I think most people don't even know that somebody as specific, as special, and as sensitive as you're out there for all our families. So that's the first way to go, I think, and the more of such lectures or training programs or awareness meets, or maybe we write, and all of your videos, all of those will also definitely go a long way in
Right.
increasing.
Chitra, because the issue here is, sorry, I'm interrupting this issue because it just came to my mind. See, I am technically a pediatric dentist. My ability to treat the mouth, to treat children, and their mouth stops at the child at 18. But I'm all the time looking after adults. I'm looking after individuals with disabilities and special needs who are in their 30s and in their 40s, which is not even my area of expertise. But they come to me because there's nobody in that space to take care of them. General dentists or specialist dentists are not trained in India to treat individuals with disabilities and special needs, which is the case in the more developed Western world. But there again, the sensitivity itself to special needs and disabilities is so much more. So that is why I'm saying it just has to start with society. It has to start way up there, where right from the government and the health agencies, where the whole society at large starts to recognize the rights. First the rights and then the needs. There are rights first. The rights and the needs of these individuals. So I am treating all of these adults. And when they need care that I cannot provide, then we take them under general anesthesia. And I'm fortunate to have a spouse who's a specialist in treating adults with advanced dental needs. And then he gets into the picture, Dr. Udat Kher, and then he gets into the OT and provides care for them. But I am fortunate I have that support system in my, extended team, let me say, and family, where I can use that. But otherwise, there are no specialists to take care of adults. And what is one individual in a city like Mumbai, forget a country. Though I have to say here, all pediatric dentists are trained in delivering care for children with special needs. So wherever you are in this city or wherever you are in this country, if you look out for a pediatric dentist, they will be far better equipped to care for your child. And we are many, many of us. And of course, you have Google now. So just Google for a pediatric dentist near you, and they will help you with your child's oral healthcare needs. So I think that is step one for any family that requires dental care, to look for a pediatric dentist near them and to go and approach them for their child.
That was fantastic, Meenakshi. I think what you said there was really, really important, because I think most people don't even know that, they can actually go to a specialist, and what you've just shared about every pediatric dentist can actually handle a child with disability is
Absolutely.
is so perfect. So thank you so much for sharing your journey of setting up such an amazing practice at Happy Tooth, and we've been fortunate. It has helped so many children and their families. You've shared some excellent pointers through the podcast for us parents about how the younger ones need to visit the dentist much earlier on. Build the practice of sitting on a dentist chair for a child. Also, the very important aspect of reducing sugar in the diet, especially for all our children who somehow have the sweet tooth. And what you even spoke about in therapy, how that's a very important point that you spoke on, where the rewards usually tend to be the sweeter side. Thank you in the end for talking about how people can be made more aware of disability. Thank you for being for being so passionate, so compassionate, and along with your passion for work, being able to do this so lovingly for all the children who visit you and the adults. Your I'm sure that this podcast will definitely touch people who are listening in, because your passion comes through. It's so contagious also. And I hope others in your profession and in other professions also would think of building such kind of state of the art facilities that you envisaged way back, right from a play area to things that can sensitize and make a person more comfortable. So I do wish and hope that many will listen to you, both the families as well as all the professionals. And this was wonderful. So thank you so much for your time, and wishing you all the very best.
Thank you, Chitra. Thank you so much for having me, and all the best to all your endeavors. And I'm whatever I can do for your endeavors, I'm just one call away. Thank you. Thank you so much.
You were listening to the Special Needs Children podcast with Chitra Iyer, the CEO of MFA and a trustee with the Forum for Autism. If you find this podcast relevant and interesting, it will be great if you leave a review, share, like and subscribe. You can also let us know if there is any specific topic that you would like us to cover. Feel free to email her on chitra.iyer@myfinad.com, or you can call her on 9833785892. That is 9833785892.